Cystic fibrosis, or CF for short, is a genetic disorder that affects mostly the lungs, but also the pancreas, liver, kidneys, and intestines. Long-term issues include difficulty breathing, and coughing up mucus, as a result of frequent lung infections. Other signs and symptoms may include sinus infections, poor growth, fatty stool, clubbing of the fingers and toes, and infertility in most males. CF is inherited in an autosomal recessive manner. It is caused by the presence of mutations in both copies of the gene for the cystic fibrosis transmembrane conductance regulator, or CFTR, protein. Those with a single working copy of CFTR are carriers, and otherwise mostly normal. CFTR is involved in the production of sweat, digestive fluids, and mucus. When the CFTR is not functional, secretions, which are usually thin, become thick. The condition is diagnosed by a sweat test, and genetic testing. In parts of the world, where the defect in the gene is very common, screening of infants at birth with a sweat test may take place. There is no known cure for cystic fibrosis, and the most common complications come from lung infections. Acute lung infections are treated with antibiotics, which may be given intravenously, inhaled, or by mouth. Airway clearance techniques, such as chest physiotherapy, have some short-term benefit, but the long-term effects are unclear. Sometimes, when someone has repeated infections, the antibiotic azithromycin is used long-term. Inhaled hypertonic saline, and salbutamol, may also be useful. And lung transplantation may be an option, when lung function becomes very poor. Aside from treatment of the lungs, pancreatic enzyme replacement, and fat-soluble vitamin supplementation are also important, especially in the young. The average life expectancy, for those affected by CF, is between 42 and 50 years, in the developed world, with lung problems being responsible for roughly 80% of related deaths. CF is most common among people of Northern European ancestry, and affects about 1 out of every 3,000 newborns. In addition, about 1 in 25 people in Northern Europe is a CF gene carrier. The disease is least common in Africans and Asians. Cystic fibrosis was first recognized as a specific disease by Dorothy Anderson in 1938, although descriptions of conditions that fit the disease have been found as far back as the year 1595. The name, cystic fibrosis, refers to the characteristic scarring, fibrosis, and cysts that form within the pancreas.